You step on the scales this morning, the number hasn't changed much. Maybe it's crept up a kilo or two over the past year, nothing dramatic. You tell yourself you're fine. However, there's an issue with that reasoning. The scales tell you how much you weigh. They do not tell you what you weigh. And for men over 40, that distinction can be the difference between a normal health check and a silent, accelerating risk for heart disease, type 2 diabetes and stroke. Today, I want to show you a measurement that takes about 30 seconds, costs nothing, and tells you far more about your metabolic health than your weight alone. This measurement is just your waist circumference, and if you've never measured it properly, I suggest you do it as soon as you've finished watching this video. And stay with me to the end because I'm going to show you a simple refinement to that measurement, one that takes your body size into account, and that turns out to be an even stronger prediction of your metabolic risk. It only takes about 5 seconds to calculate once you've got your waist circumference. I'm Dr. David Stokes. I'm a GP with over 18 years of clinical experience working across both the NHS and private practice. On this channel, I talk about the things that really matter for your long-term health, not the things that get 5 minutes in a 10-minute appointment. This video is aimed at men in their 40s, 50s and 60s, and that's not because women don't need to hear about this, they do, but I'll make a separate video for them. But this is because visceral fat accumulation in middle-aged men is one of the most under-recognised and under-discussed health risks. And I see this in practice all the time, and it's almost entirely preventable. Let me start with the tools that most of us use to judge our weight: the bathroom scales and the BMI chart, the body mass index chart. Both of these have their uses, and I'm not dismissing them entirely, but they share a critical blind spot. They cannot tell you where your fat is sitting. Like they say on all of the property sales programs you'll watch, location, it turns out, is everything. Now, your body stores fat in two fundamentally different ways. The first is the subcutaneous fat, the fat that you can pinch. It sits just beneath your skin, on your thighs, your hips, your arms. It's the soft layer around the middle. And while it's not entirely inert metabolically, it is broadly speaking relatively benign. The second type of fat storage is visceral fat. This sits deeper inside your abdominal cavity and packed around your liver, your pancreas, your intestines. You can't see it, you can't feel it, and you certainly can't measure it with bathroom scales. And this is a crucial point. Two men can have exactly the same body mass index, let's say 27, which is in the overweight range but not yet obese. One of them carries most of their extra weight as subcutaneous fat. They're soft around the edges, but metabolically they're relatively safe. The other carries theirs as visceral fat. They have a compact, hard abdomen but a prominent belly. They don't necessarily have a particularly high number on the scales. But these two men have got very different risk profiles, and body mass index treats them identically. This phenomenon even has a name in the literature: metabolically obese, normal weight. A person with a perfectly normal body mass index but significant visceral fat accumulation and all of the metabolic consequences that follow. So why is this visceral fat so much more dangerous? Visceral fat is not just passive storage. It behaves like a metabolically active organ, and not a good one. Trying to explain the proposed mechanism for this in as simple a way as I can, the visceral fat sits around and next to the portal vein, the major blood vessel that drains blood from the gut directly into the liver. When visceral fat tissue becomes enlarged and inflamed, it releases free fatty acids, inflammatory proteins, cytokines, directly into that portal circulation. They go straight to your liver before they reach the rest of the body. Once in the liver, these signals cause two things. Firstly, the liver becomes resistant to insulin. So instead of shutting down glucose production, which the liver does at times when glucose is needed, the insulin being present should switch it off, and it just doesn't. It keeps producing the sugar. Your blood sugar rises, and your pancreas then responds by producing more insulin. This is a vicious cycle of elevated insulin, rising blood glucose, which over years progresses towards type 2 diabetes. Secondly, the liver shifts its fat metabolism into an unfavourable mode. It produces more triglycerides. lowers the HDL, the good cholesterol, and increases the small, dense LDL particles, which are precisely the lipid profile you see with cardiovascular disease. And so this is why visceral fat is not just a cosmetic problem, it's not just a beer belly, it's an endocrine problem, a metabolic problem, and a cardiovascular problem, all happening silently, often for years before a blood test or clinical event brings this to light. And here's the thing that makes it particularly insidious in men. The hormonal shift that often happens in your 40s, declining testosterone, rising cortisol from chronic work stress, changing sleep patterns, actively promotes visceral fat deposition. Men in this decade are biologically predisposed to accumulating this visceral fat, often without significant gain of weight on the scales. Now I want to introduce a term you may have heard, but perhaps not had explained clearly: metabolic syndrome. Metabolic syndrome is not a single disease. It's a cluster of 5 risk factors that frequently travel together, each one of them raising your risk of cardiovascular disease, as well as type 2 diabetes. But the risk factors combining multiply that significantly. The 5 criteria as defined by the International Diabetes Federation and the American Heart Association in their joint consensus definitions are: 1. An increased waist circumference, central obesity. Particularly in men of European descent, this means a waist circumference above 94 centimetres, with any measurement above 102 being classified as high risk. 2. Elevated triglycerides, above 1.7 millimoles per litre on a fasting blood test. 3. Reduced HDL cholesterol, the so-called good cholesterol, and certainly anything below 1 millimole per litre in men would be counted. 4. Elevated blood pressure. Anything in this case above 130/85 is counted as an increased risk. And 5. An elevated fasting glucose above 5.6 millimoles per litre. Now you meet the criteria for metabolic syndrome if you have central obesity plus any 2 of the remaining 4. And I want to be clear, in my clinical experience, many men in their 40s, 50s and 60s who come in for a routine check will have 3 or 4 of these without knowing it. They will feel broadly fine and nothing will have alarmed them, but the trajectory in this situation is not good. Metabolic syndrome is sometimes called the silent cardiovascular countdown. And the first, most practical measurement, the one that costs nothing, is your waist. Now, how you measure this is important because a lot of people will do it incorrectly. You don't measure at the narrowest part of your torso, so not down over your belt line. Don't suck your stomach in, it's not going to be doing you any favours. You need to find the midpoint between the bottom of the ribs and the top of your hip bone, the iliac crest at the front. Once you've found this point, you wrap a tape measure around your bare skin at that point, keeping it horizontal. Breathe out gently and take the measurement. Here are the numbers you need to know. For men of European descent, below 94 centimetres is low risk, with 94 to 102 centimetres being an increased risk, and this is where action is warranted. Above 102, this is high risk, and I think you should be looking for a proper assessment, checking with your doctor to get your lipids and blood sugars checked. There are different thresholds for South Asian, East Asian and other ethnic backgrounds. I will try and put some information about this down in the description below, so if it applies to you, look below to see what your numbers should be. Why do we have these differences? Well, people in different ethnic backgrounds tend to store their fat in different places, and people of the Asian background tend to have a lower threshold, down around 90 centimetres, because visceral fat accumulation tends to occur at a lower BMI and a smaller waist size than in other populations. Now, the important question: what actually shifts visceral fat? Now, the good news here is that visceral fat responds well to intervention, better in fact than the subcutaneous fat. And here are the things that the evidence supports. Firstly, resistance training. Building and maintaining muscle mass is one of the most effective metabolic interventions available to men over 40. Now, muscle tissue is metabolically active in a good way. It consumes glucose even at rest, and it improves insulin sensitivity directly. The data on resistance training as a treatment for metabolic syndrome is very impressive and underutilised. Secondly, reducing ultra-processed food. The mechanism here is not simply caloric. Ultra-processed foods promote visceral fat deposition through insulin spikes, disrupting of the appetite hormones, and promotion of systemic inflammation. Reducing ultra-processed foods and replacing them with whole food sources, particularly ones with a good protein source, shifts that metabolic trajectory meaningfully. Thirdly, sleep. Chronic sleep restriction, less than 6 hours a night, is a direct driver of cortisol elevation, which in turn promotes visceral fat accumulation. This is one of the most underappreciated levers we have in metabolic health. Fourth, alcohol. I raise this gently because it's often a sensitive thing to talk about, but the evidence is clear. Alcohol, particularly regular evening drinking, which is common in this age group, directly promotes visceral fat deposition and worse insulin resistance. Even modest reductions in this can make a significant difference to your visceral fat. And fifth, structured aerobic exercise. So this is often known as zone 2 training, where you have sustained moderate intensity cardiovascular exercise that you could continue to hold a conversation during. It's particularly effective at improving mitochondrial function and fat oxidation. We say you should be aiming for 150 minutes a week. I want to emphasize here that you don't need to lose dramatic amounts of weight on the scales to see a significant metabolic improvement, because visceral fat is preferentially mobilized early in any of these lifestyle interventions. Your waist measurement often improves rapidly before your weight does. The scales may barely move while your metabolic risk profile shifts in a meaningful way. That is not a failure of the intervention. This is exactly how it is supposed to work. So, at the start of the video, I promised a simple refinement to the waist measurement, one that accounts for body and frame size, and is actually a stronger predictor of your metabolic risk than waist circumference alone. And here it is. I just want to say before I give it to you that the thresholds I gave before hold, and they are still useful and what will probably be taken into account by your doctor. However, if your waist is 97 centimeters in circumference and you're 5'8", it has quite a different meaning to someone who has the same waist circumference and is 6'4". The frame is simply different, and a single absolute number cannot capture that. This simple change is the weight to height ratio, and that solves the problem. All you need to do is divide your waist circumference by your height, preferably both in centimetres. So if your waist is 96 centimetres and your height is 182 centimetres, your waist to height ratio is 0.53. A systematic review published in Obesity Reviews, drawing on data from hundreds of thousands of people, found that a waist to height ratio above 0.5 is a stronger predictor of cardiometabolic risk than waist circumference alone, precisely because it adjusts for body size. So the practical message here is simple. Keep your waist less than half of your height. So if your waist is above 94 centimetres, I'd recommend getting your bloods checked for your lipids and your sugars. This might be available through an NHS health check or a health check through work. Now ideally we would want a full fasting lipid profile because we want to know what the triglycerides as well as the HDL are. Check your blood pressure. There's a link here to a video I made all about blood pressure which you might find interesting. So what are you waiting for? Go on now, measure your waist, work out what's going on. It'll take you 30 seconds and it'll check whether you need to have anything else done to make you healthy for the long term. I hope you found this useful. Please do consider subscribing and sharing this with anyone else in your family or friends who you feel may benefit from this. Take care and I'll see you in the next video. Bye bye.